Okay, my name is Danielle Kirkendall, and I'm doing my presentation on healthcare in developing countries. And I want to focus particularly on Vietnam and its healthcare system. I'm going to go to the next slide. As an American, it's hard for us to imagine not having quality access or care. However, in some developing countries, like Vietnam, patients must share beds for treatment because there just aren't enough beds. I can't imagine being sick and have to share a bed with another sick patient. No, I can't imagine that at all. Not only many red flags are going off regarding HIPAA laws, infection control issues, quality access, but no privacy at all. Hospital stays are already uncomfortable, and having to share beds doesn't make it better. I'm going to go over two scenarios in this presentation. It will show you what citizens in Vietnam are going through in their healthcare system. Okay, the first thing you see in this picture is overcrowding. Now picture this. You're in a hospital, you're waiting to be seen, and it's extremely overcrowded. You're sitting in a busy waiting area waiting to be seen, but it takes hours to be called in the back. When you're finally called back there, you walk into a room that has 10 beds, easily, with 2 to 3 patients in it. So if you take that, that's 30 patients in one room. Overcrowding is tremendous in Vietnam. Can you imagine this? Can you picture this? By looking at this picture, I'm going to do scenario 2 on the next slide. Okay, the pediatric hospitals are having overcrowding issues also. Now here's another scenario. There's a severe bed shortage in a hospital in Vietnam. Many patients are lined up in the hallways waiting to be seen. Many children sleeping under the beds in the hallway or wherever their parents can find enough space for a hammock or small mattress to sleep on. As a parent, can you imagine this? Sitting out in a hall, just like these moms right here in this picture, waiting for your baby to be seen. Or not knowing if your baby will get another infection because the infection control is not controlled. Many pediatric patients come in with one infectious disease and a lot of times leave with another due to the fact of overcrowding. Now, on the next slide, I have a short video showing how Vietnam is trying to cope with overcrowding in a heart hospital. And you can watch this video. It's about a minute long. As you can see, Vietnam is truly trying to make it better for overcrowding and bed sharing in their hospitals. The short video has shown that they are trying to make the access to care better. They tried to transfer patients to other hospitals, however, due to those other hospitals being strained, they're not able to transfer patients. So they started adding beds to the hospitals that they have now. That heart hospital added 1,000 beds, as you could hear in the video. In conclusion, many Americans could not imagine having a healthcare system like this. We are unfortunately very lucky to have a healthcare system that has quality access, laws that prevent overcrowding, and laws that helps us with infection control. Vietnam is going to continually work diligently to better their healthcare system, but they truly do have to focus on the overcrowding for their patients. This concludes my presentation on healthcare delivery system in developing countries, mainly focused on Vietnam. Thank you.